confirmation from the Health Minister, Dr. Paahla, that our hospitals have a large number of unfilled posts. To put it another way, there are huge shortages of nurses and doctors. In reply to a parliamentary question from the Freedom Front Plus, the Minister confirming there's a shortage of 10,000 nurses and over 1,300 doctors. At the same time, we know that hundreds of health workers are going to lose their jobs because their posts are not being filled after the pandemic. Dr. Aslam Dasoo is the coordinator of the Progressive Health Forum. Dr. Dasoo, good afternoon to you. What leads to this huge problem? We understand that there are posts, we understand that there are shortages of money, but why do we continue to have such a big shortage of nurses and doctors?
Good afternoon, Stephen. You're asking a big question there. Look, the problem begins way back when we established the constitutional order, where healthcare has been deemed to be a provincial competence. In other words, the national budget is distributed to 9 different provinces to use as they see fit according to certain guidelines. The problem with that, of course, is that you don't have control of those funds, and they are used by different provinces in different ways. Most of the wastage in public budgets seems to come from the health sector, and that just is a spiral that has continued over the last 20-odd years, to the extent that the funding available for especially hospitals has not kept pace with the population growth, with the demand in services, with the increasing burden of disease. And because of that, because there's no money, posts that become vacant, people leave, people retire, whatever, are just frozen. They're not refunded. So you have a huge defunding problem taken over a couple of decades to leave us in this very difficult situation right now. It doesn't help that there's so much corruption in the health budget. It doesn't help that there's very poor local management of facilities. And it doesn't help that facilities themselves cannot manage their own finances. And this, I think, all comes together to give us this terrible situation.
So, if I've understood correctly, these posts were originally budgeted for, which means that at some point someone said, we need this post. And this will have happened 10,000 times for nurses and 1,330 times for doctors. Someone decided that we need this post. What happens after that? There was no conscious decision surely taken that we no longer need this post. Other things started to happen.
Of course. Look, I think the situation also in the provinces is, they're always chasing. They're always trying to catch up with the demand. So on the back foot all the time. So decisions are made on the hoof. Money that is available is then distributed. Of course, the biggest component of expenditure is health staff. But, the fact that we don't have sufficient numbers of health staff tells you that there's a mismatch between what the budget is and what is actually required. Now, the effect of that is that the remaining staff take on a bigger burden of patients. And with that will come a point where they can't treat these people effectively or efficiently, and then patient health begins to suffer. Facility management can't do anything about it. Patients get increasingly frustrated, blame the health workers, and that are doing their best. And on top of that, you now have a pandemic. Now, at that point, health workers went above and beyond the call of duty. In their constrained circumstances, they really pulled out all the stops, to help the country through this for the last 2 years. And one would think that here must be a government that has seen this, that understands the problem, and instead of spending billions on really unnecessary matters I won't mention, you know them better than I do, spend the money on hiring the nurses and the doctors who are available. They are in the country, and put them into these posts. It doesn't matter that you don't spend money on defense contracts to have your trucks fixed in Cuba and so on. That will not matter a jot to the country. What will matter is having efficient public health services. There's a real problem. There's been a migration of effectively middle class and lower middle class people out of the public sector. And I think that's a result of the very poor services they get, and they'd rather pay eye-watering medical aid premiums to get private care. Linked to that is a very poor regulatory regime for private health care. So, it just blossoms and it just grows. It draws more staff out of the public sector because they get better conditions of work, and they don't want to go back and work in those conditions. So a spiral begins in the public sector that has to be stopped. The health market inquiry identified this, but the government has steadfastly refused to implement its recommendations. And ironically, it was the health department that initiated that inquiry. Instead, we have fed the thin gruel of NHI, and nobody knows what that is or how it will help. But, it's kind of used as a political flag-waving exercise to tell people things will get better. It won't, not with that plan. However, if they were to focus on this health market inquiry, regulate the private sector better, but have a relentless focus on fixing the public health sector, bringing in the provincial departments into some measure of national budgetary control, I think we can get a handle on this. It won't be easy. It will take huge political will, which we know is in short supply, but that's the way to fix the problem.
So the problem isn't that there's a shortage of nurses and doctors. I mean, we know that we lose a lot of our nurses and doctors to other countries. You go to Britain, Britain's National Health Service has, hundreds, I think, thousands of South African nurses and doctors. Is the problem that we're losing them to better salaries, perhaps? Or is the problem that we're just not managing the resources that we have? It seems to be a combination of several factors that you're already pointing to.
Sure. And I think, look, there's another matter. Let's not even look at what's happening to our staff leaving these shores. Just look at staff that have moved into the private sector. I can assure you there are senior clinicians who, because they've turned 65, suddenly don't get a paycheck and get told by a clerk, sorry, you're no longer employed. So we lose 40 years of medical experience that you can't buy, and they leave. And they are very unhappy in working in the private sector where they have to work alone rather than in the team-based approach of public health care, which is what they know and which is what they're good at, and which in fact provides better health care. So I think if there's an improvement in the management of public facilities, in the funding of public facilities, you might start seeing an exodus back into the public sector of clinicians. These are not people who are unemployed. Then you do have that cohort of unemployed doctors and nurses as well, that they are simply not going after. Because as soon as a CFO of a provincial health department says, okay, so we've lost so many nurses, we've lost so many doctors, we don't have the money to fix them or to rehire, we're going to just freeze these posts. And that works out in the accounting for them. But it has a terrible toll on both the services and on the patients themselves. We've seen what's happened in Gauteng. This province has absolutely created the most complex and comprehensive health system on this continent. Is being run like a spaza, honestly, and I'm not using that word lightly, but it's being run as though it must fit with the stringent, not the stringent, but the constrained accounting of the department, who don't know what to do. We've had Charlotte Makleke out of action for a year. We can't fix one hospital. We've got medieval conditions at Helen Joseph's emergency department. Medieval, and I'm not exaggerating that. I think when you go in there and you understand that this is a major teaching hospital in the middle of the most industrialized city on this continent, undergoing such horrendous circumstances, then you begin to wonder about the systemic management of the health system. And I'll tell you this, it becomes a national security issue because it will have an impact not just on healthcare, but on even investment and on people traveling to this country and wanting to settle here. So when your major facilities in your major cities start to experience this, you have to ask a question of who's running it. And that question must be answered. We get deflected to many other things, but no one stands up and puts the finger right on that and demands answers. The lack of accountability is legion, you know that too. And unfortunately, we are now in a bind. and how we get out of it will take huge political will. We can do it. This can be fixed. But I don't know if there's a will, and certainly we know there's a lack of capability in the civil service to do so.
I mean, Dr. Dasoo, I mean, all the way through what you've said today has been the issue around a lack of resources, but we spend an absolute fortune on healthcare. I mean, health and education are the two big things that we spend money on. So it's not just a shortage of resources. What you say must be true. It's problems with management. I accept that we have a very high patient load. I accept that provinces have to treat people from other parts of the country, other parts of Southern Africa. I accept all of those things. We still spend a lot of money that seems to be going, well, not to healthcare.
No. You know, in the first 5 years of democracy, we engaged in probably one of the biggest clinic building programs in the world. I think we built or refurbished about 1,000 primary care clinics, bringing healthcare for the first time to every South African within 10 kilometers of where they lived. This was a remarkable achievement, you know, where a woman living in a village near Guyana would normally have a child who has gastro and wouldn't be able to treat it, and the child may die. Now has a nurse who can put in a drip and the child lives. That's 100% improvement in her experience. We did not maintain that. After 2000, you know, the HIV/AIDS issue hit us. There's no doubt about that. And the burden of disease grew. But the management fragmented. And the focus shifted to other things. Instead of consolidating what is the most comprehensive health system on this continent, this public health system. And it's gone to seed, unfortunately, as a result. The money, as you say, we spend a huge amount of our GDP on health care. But half of it is spent on private care, and the other half is budgeted for public care. And ostensibly, that's the basis or the premise by which NHI is brought forth, that we need to pool all these funds. What is not understood is that only half of that is actually taxpayer funded. The other half is voluntary contributions and after tax. So you can't pool this money. People, why should they pool it? It's their own money. So what you now have is, again, chasing our tails, trying to play catch up with something that you can't catch just by throwing more money at it. You're going to need to fix the management of the system. That too can be done. But that, like I said, I'll come back to this point, it requires decisive political leadership to do that. And when you've got a provincial executive that is empowered in terms of the Constitution to manage budgets as it deems fit, that's not likely to happen.
Dr. Aslam Dasoo from the Progressive Health Forum, I really appreciate the time. Thank you very much indeed.